Please mention in the chat box. Is my screen visible? Am I audible? So today's topic is electrolytes, chapter 10, page 206. Those who have the textbook, page 206. If anyone is joining late, please help them out with the page number or the topic name. So electrolytes, all mineral salts whose ions dissolve in water are called electrolytes. Water ions, they carry charge, either positively charged or negatively charged. Okay, they carry electric charge. All these mineral salts. Okay, electrolytes affect how your body functions in many ways, including the amount of water in your body. Okay, the major electrolytes are sodium, potassium, and chloride. You can see in the image given potassium, calcium, magnesium, sodium, they have positively charged ions. They are ions. Okay. Chloride, negatively charged cations. Okay. So they are supposed to dissolve in water and they carry a charge, electric charge. That's what we call as mineral salts. So usually we use milligrams and milli equivalents to understand the amount of electrolytes which is there in your blood serum and all. Okay. Equivalent, the formula for it is the microgram of it, milligrams, okay, multiplied by the valence. Okay, valence is the number of electrons that are outside. Atomic number formula or molecular weight should be the denominator. These are the chemistry part. Okay, you don't have to study in detail about it. Just be aware. Okay, equivalent is the formula used usually to understand the amount of um, electrolytes present in your body fluid or blood serum. And to convert milli equivalent into milligram, you just have to do cross multiplication, okay? Crossing over the bridge. Whatever is multiplication on the other side will become division for the other side, okay? So that is cross multiplication. So these are the two formulas which we usually use to calculate the amount of minerals present. Okay, is it normal or abnormal? So sodium is a major regular of fluid balance and volume. It is essential for nerve transmission and muscle function. Enough amount of sodium will replace your losses in sweat because through sweat also you lose sodium. Okay. And the main function of sodium in your body, it helps to absorb and retain fluids and distribute the fluids. So you stay hydrated from within. Okay. And this drives your hydration. Okay, enough amount of sodium will keep your body internally hydrated because it is able to hold on to water. Okay, Requirements of sodium and absorption and excretion every day at least 3000 to 6000 microgram of sodium is required by a healthy human body. Okay, but if you're suffering from hypertension, high BP, other kidney related disorders, these numbers will change. Most of the absorption of sodium will take place in stomach or the small intestine. And once it is absorbed by the small intestine, directly through active transportation, it will get absorbed into the capillaries. From there, it will reach the blood. And the blood will carry sodium throughout the body. If there is too much of sodium, it will be filtered out by the kidneys. Okay. Hormones like aldosterone, renin, these are also supposed to control the sodium levels in your body. Okay. Aldosterone is a hormone which is secreted by your adrenal gland. Adrenal gland is situated just above the kidney. Okay. And it increases the resorption of sodium. Resorption means when blood is passing through kidney, it's getting filtered through kidney. Initially, all the sodium will be taken out. Okay. But you are not supposed to lose all the sodium in that single filtration. Okay. So in the collecting ducts itself, the sodium will get absorbed back, okay, into the body. First, the blood is reaching the kidney. Kidneys will take out the sodium. But within the kidney itself, once it has taken out, once the sodium moves forward, it will be reabsorbed back into the body. Okay, so that is what aldosterone, the hormone, helps in doing. It helps in reabsorption of sodium. Then you have renin. Renin is usually like an enzyme, and it is secreted by your kidney. It converts angiotensinogen into angiotensin 1, angiotensin 2, and to aldosterone. So renin is an enzyme that helps in production of aldosterone and also it controls BP. Okay, angiotensin and all is used to constrict and dilate your blood vessels. Okay, and if at all there is excess of sodium, that will be lost in your urine, okay, and in your sweat. Coming to metabolism, jejunum and in ileum, these are the last two parts of your small intestine. The sodium that is absorbed in the jejunal region and the ileum region, okay, and also some amount of it will be absorbed in the large intestine as well, but not in the rectum, okay. So stomach, small intestine, some part of it can be absorbed in the large intestine, but not in the rectum. Regulation of sodium balance. As the input of sodium is controlled by dietary habits rather than requirements, sodium balance is achieved by the body only by regulating the output. Okay. So kidney plays an important role in maintenance of sodium balance. How much salt you take in, how much sodium laden salty food you take in, and how well the kidneys are uh, excreting out excess sodium. That is the main regulation. Either you can control your dietary habits if your kidneys are not functioning well, control your dietary habits. And distribution, half of the sodium that your body takes in is found in all the extracellular fluid, like your blood, serum, plasma, okay? Intercellular fluid, fluid which is there in between the cells, not inside the cells, okay? So that becomes the extracellular fluid, okay? 10% of it is found in the cells, with inside the cells, and the remaining will be deposited in your skeletal system. That is how sodium is distributed throughout your body. Hyponatremia is a situation in which you your blood has very low sodium level. Hyponatremia is a situation where your blood will have very low sodium level. Okay. So what are the symptoms of hyponatremia? There will be changes in your behavior, fatigue, okay, convulsions, seizures, feeling very weak, loss of consciousness or coma, very low blood pressure, feeling nauseous or vomiting. Okay, so these are the signs and symptoms of hyponatremia. Very low sodium levels in your blood. That is hyponatremia. Sources of sodium, table salt, the salt that you use at home, salty food, animal food, milk, baking soda, eggs, cereals, carrots, tomatoes, legumes, they all have sodium. Okay. RDA is just 1 to 5 grams per day. And those who have a history of hypertension, that is high BP, blood pressure, just 1 gram of sodium chloride per day, 1 gram of salt per day. Okay. And if you take too much of sodium, hypernatremia, too much of sodium in your blood, high blood pressure, heart failure, left ventricular hypertrophy, stroke, gastric cancer, edema, kidney problems, kidney stones, these can happen if you are taking too much of salt in your diet. Next, coming to potassium. So, potassium, it helps your cells to take up nutrients and water. Okay. Sodium will keep your body hydrated. Potassium will make sure your cells take up the nutrients and water, so that at cellular level you are hydrated. Okay. It also helps your muscles to contract. It also helps your nerves carrying messages between brain and body. Balances your body fluids, regulates blood pressure. It also helps your body to digest food because it is used in certain enzyme production. Okay, so these are the main functions of potassium. So potassium is readily absorbed by passive diffusion from your gastrointestinal tract. Okay, the amount of potassium in the body, it depends on the balance between potassium intake and output. How much potassium you are eating and how much you are throwing out of your body. That is the one that creates the balance. Okay. Potassium output occurs through three primary routes. First is your GI tract, your skin and urine. Okay. Either through feces you will lose the potassium, or through urination you will lose the potassium, and also through sweat. Okay. Just like sodium. In case of potassium deficiency, what would happen? It will affect your blood pressure. Okay. Blood pressure will increase, breathing difficulty, heart palpitations. You will have a tingling numbness sensation because your nerve endings and nerve messengers are not working fine. Muscle cramps, okay, because there will be abnormal contractions in your muscle. Potassium will maintain the normal contraction of your muscle. Mood swings, digestive problem because enzymes are not getting produced. Okay, weakness and general fatigue will be there. Okay, RDA of potassium is given on table 10.2 on page number 212. Those who have the textbook, page number 212 for adult man, woman. Okay, potassium requirement is slightly higher than the sodium requirement for adults. So that chart you can study for this potassium RDA. Toxicity, cardiac, when there is too much of potassium in your diet, okay? If there is an overload of potassium, what will happen? Cardiac arrest, heart failure, renal failure can take place, okay? Sources of potassium, soybean, green gram, black gram, okay, dry raisins, black raisins. These are the best sources of potassium. Banana as well. Banana is known, but banana is a good source. But the best sources are urad dal, moong dal, okay, soya bean, black raisins, okay, and other millets, bajra, ragi, wheat. They also have potassium. Tamarind as well, imli, okay. Coming to chloride. Chloride is present as chloride ion and it is the major anion in the extracellular fluid. Okay, it carries that negative charge, like it is charged negative electric charge. And the main function of chlorine, it is supposed to regulate the water balance, maintain the osmotic pressure within the cells, outside the cells. Okay, along with sodium, both sodium and chloride will work together to create this osmotic pressure and balance, acid-base balance. Okay. It also helps in nerve impulse conduction, sending the messages to and from the brain to other body parts. Okay. That is impulse conduction. And to form HCl acid in your stomach, hydrochloric acid in your stomach. The stomach has this hydrochloric acid. Okay. So the chloric part from the hydrochloric acid, it comes from chloride. Okay, so these are the main functions of chloride. Again, it is largely found in your extracellular fluid, not inside the cell but outside the cell, because that's where it has to create that osmotic pressure, balance the osmotic pressure and balance the pH of the fluid around the cell. Absorption and excretion completely from the gastrointestinal tract, that is from your small intestine. Under normal condition, if you are healthy, okay, the chlorine excretion will take place again in three ways: through your GI tract, feces, sweat, through your skin, and through urination. Okay, excess chlorine will be dumped out of the body through these three routes. Chloride is excreted mostly as sodium chloride, as salt itself. Okay, and mostly it is excreted through the kidneys. And just 2% is eliminated through feces. Okay. The plasma chloride level, normal plasma chloride level, should be around 95 to 105 milli equivalent per liter of serum. Okay. Deficiency of chloride is very rare because everyone have access to table salt. Okay, salt is something is affordable, attainable, okay, efficiently used in all households. So deficiency of chloride does not take place. It's very rare. And the best source of chloride is your table salt. Okay, you have to just depend on your salt intake for chloride. That's it. Okay. So that's about electrolytes. If you have any query, you can mention in the chat box.